afternoon. My name is Julie Poppy, and I'm with the Early Care and Education Project at NCSL, and I want to thank everyone for being on the webinar called Equity Starts Early, Strategies to Consider in Promoting High-Quality Early Education. Today we have nearly 30 states on the webinar. I'm also joined by Robin Lipkowitz, and a special thanks to all the early learning fellows listening today. So more than half of low-income children, compared to 1/4 of their affluent peers, lack the necessary skills to start school ready to learn, and these disparities seem to widen over time. Today's webinar will examine the recent report by the Council of Chief State School Officers, which identified 5 key policy areas to consider that can possibly help close the achievement gap and also improve early childhood programs. We're going to hear from 2 state leaders from Louisiana and West Virginia who are working on one or more of these recommendations. So we know that some of you participating only by phone and aren't on the webinar platform, and we appreciate your ability to join us and listen in. An archived copy of this webinar will be available and posted to NCSL's website shortly. Once posted, NCSL staff will send an email out alerting you to the availability of this archived webinar. So our goals for the next hour is to make this presentation as interactive as possible. Should you have a question, please note that you can type them at any time in the chat box that's on your computer screen. We'll aim to answer as many questions as possible during the hour and at the conclusion of this presentation. If all questions aren't answered, we're going to aim to answer them and we'll email them out to you. So in a moment, I'm going to hand it over to Tom Schultz with CCSSO, who will provide some background for us and highlight the 5 key findings from CCSSO report that state legislators might want to consider. And CCSSO's report is a resource on the webinar today. It should be coming up now in your chat box. Let's see. Before I turn the webinar over, I'm going to give a little information about the 3 presenters. So I'm just going to provide an abbreviated version of the bio. Tom Schultz is Project Director for the Early Childhood Initiatives at the Council of Chief State School Officers and has worked on early childhood research and policy areas. He's done much work. Again, he's going to highlight CCSSO's new report and the 5 recommendations which state legislators might want to consider. After Tom is Jenna. Jenna Conway is an Assistant Superintendent for Early Childhood at the Louisiana Department of Education. Jenna worked as a DV counselor in New York and administered a 9/11 Victims Fund, ran a shelter, and worked in public housing. And it looks like she keeps busy with her husband and her 2 kids. Jenna's going to be talking about some of the work going on in Louisiana that aligns with a few of CCSSO's recommendations. Then we have Clayton Birch, and he is Chief Academic Officer for West Virginia Department of Education and previously directed the West Virginia Department of Education Office of Early Learning. He leads the Division of Teaching and Learning, which targets early learning, middle school, secondary learning, assessment, and special education. And Clayton is going to talk about the work going on in West Virginia. So we're going to hear from the presenters, and we're going to hear about these recommendations, and then we're also going to connect it to what this means for state legislators. So with that, I'm going to turn this over to Tom.
Thanks very much, Julie. I appreciate this opportunity to share with legislative leaders that I think have so much influence on investing in programs for young children, and I appreciate the interest from so many folks in the Fellows program this year. As Julie mentioned, I'm going to just share some of the high points from a project that we completed this March with our leadership from Council of Chief State School Officers to try to look at how high-quality early childhood investments and strategies could help to contribute to preventing and eliminating achievement gaps for students who enter school with multiple risk factors or limitations based on their early learning experiences that tend to lead to long-term problems in terms of their progress in the public education system. The report really is based on a tremendous amount of evidence that is accumulated in recent years that give us a much better picture of how young children develop and learn starting from birth, and the importance of those early learning years extending up through kindergarten and third grade in terms of a foundation for ongoing school success. What I'm going to try to do is highlight some of the evidence that led our members as Chief State School Officers to put this project as a priority, and then summarize the recommendations that we developed, which I think will be illustrated by the presenters that follow me in terms of strategies that are being enacted in both Louisiana and West Virginia. So starting from some of the research that's emerged that you may be quite familiar with regarding issues of the achievement gap, a number of landmark studies have, I think, documented that almost as soon as we can begin assessing young children, we see disparities in their development in a number of areas of health and learning. This slide shows vocabulary development for children that grow up in homes with differing levels of parental education. And as you can see, by the time children are 3 years old, which is often when we begin enrolling them in early childhood programs, we have a six-fold disparity between students with parents who have less education versus college-educated parents. As we continue to look at research on these issues of sort of the trajectories of early learning, we see that at the time that children enter kindergarten, in both literacy and language skills and some measures of early mathematics learning, we have substantial gaps as well. And to sort of put this in more perhaps concrete language based on what researchers have looked at, one study found that low-income students tend to be roughly a year behind their same-age peers or behind national norms in language development literacy. So think about 1 million young children entering kindergarten out of a cohort of 4 million who are a year behind where other children of their age are, and the challenge that presents for them in terms of feeling confident about their ability to contribute, to participate well in kindergarten curriculum, and for their parents and kindergarten teachers in terms of bringing them on track to the standards that have been developed across the country in states or where we hope children to be in terms of their ability to be successful by the time they complete high school. Further, without showing a slide on this, we also know that the disparities that are evident at the beginning of kindergarten tend to expand as children move through kindergarten, first, second, and third grade. Much of that increase in gaps seems to be due to summer learning loss. But the way schools are presently resourced and the strategies that are provided allow children to kind of fall further behind rather than catch up during their early school years based on the position they're in when they enter school. So this sort of leads us to recognize that we need to do more in the early learning years if we want to create solutions to the achievement gap. Fortunately, we do have tremendous evidence that I know you've been looking at in your fellows program about the benefits of high-quality early childhood programs to prevent or minimize these achievement gaps, whether it's through state pre-K programs, full-day kindergarten programs, evidence-based home visiting programs, and as we're coming to understand more and more, what seems to be most pivotal is when we can give children a sequence of several years of high-quality learning opportunities in the early childhood period. So based on all this evidence, I think what Chief State School Officers have been come to ask is that we need to provide a stronger understanding in the education community and among the public as well about the importance of the early childhood years and focus attention through the various programs that are publicly funded, but also privately based and informal networks that support young children, to try to provide more enriched and intensive learning opportunities for children. We think it's important to start taking a look at how children are doing well before the end of third grade, which is when our current accountability-based testing takes place in the public schools. And then, as this report seeks to do, develop more proactive strategies to prevent these early achievement gaps and not be playing catch-up when children enter school at kindergarten. Briefly, the 5 strategies that we are recommending to our members as leaders of state departments of education and partners with legislators and governors and other state agency executives are starting with some steps that we think every state can do, every school district can do, and every community can do. Begin, 1, to form strong partnerships with families in the early childhood years, so that whether it's in pediatricians' offices or through home-based programs, home visitation programs, we give parents information and encourage them to work with their children to help them be healthy as early as possible and to make the most of learning opportunities in the home and neighborhoods that they live in. Second recommendation, make stronger connections between elementary schools and the various early childhood programs in communities around the country, whether they're publicly funded Head Start, child care programs, or state pre-K programs, or they may be private or informal care arrangements. But wherever young children are, we think that school folks need to be connected with those individuals, be able to communicate with them what is happening in kindergarten programs, and offer them support in the work that they do to bring as many children as possible to school ready to learn. Our last 3 recommendations have to do with improving the quality of the programs that are funded now. We have several million young children enrolled in state pre-K, Head Start, early Head Start, and child care development block grant programs. So while we have children who don't yet have the opportunity to participate in an early childhood program, many children are working with teachers that are funded and supported through state and federal sources. And so we think states need to do everything they can, as they're doing in states like Louisiana and West Virginia, to make these teachers well prepared to deliver a sound curriculum and build strong relationships with children. All those things are only possible if we can create a high-quality workforce for children from infant, toddler, preschool years, as well as in kindergarten, which means providing strong training and preparation, compensation that makes it attractive for talented young people to enter this field and stay in it, and ongoing support, just as we're trying to do with public school teachers. And then in order to do those 4 things, in terms of the initial recommendations, we know that funding is key, and that's one area where support from state legislators is so crucial. Before I pass along to let you hear from Jenna and Clayton, I'll just highlight some of my thoughts about what you as state legislators can do in support of the strategies that we identified in our report, because you are such key leaders in state government. We think you can help to develop systems in your state to document how young children are doing. This doesn't really mean high stakes accountability testing, but it means drawing attention to how children are developing in the early years, making use of the assessments that are conducted to screen children and track their progress, and to identify whether your state is making progress over time using the resources that you currently manage for early childhood programs. Two other ideas, one that in particular you're going to hear about some great solutions that Louisiana is working on, is to provide leadership to make it easier for parents and local community agencies to make use of the different publicly funded programs that we currently have in this country, and simplify the administrative requirements, simplify the access for parents to whatever programs they're eligible for, as well as make it easier for the managers of these programs to make use of these dollars, being accountable, but trying to minimize the burdens of administrative costs so that resources can go into the classroom. And finally, connect early childhood with what's going on in your public education reform efforts. A good example right now is the work that states are doing in planning for the Every Student Succeeds Act. So with that, I'll pause and turn it back to Julie, and look forward to your questions and the remainder of our time together.
Thanks, Tom. I'm going to turn it over to our next presenter, Jenna Conway with Louisiana.
Thank you, Julie. I'm actually having a little bit of trouble with the cursor, so if you all could move through the slides and I could just cue you verbally.
Sounds great.
Excellent. Thank you so much. Well, good afternoon, everyone. My name is Jenna Conway, as Julie introduced earlier, and I head up our early childhood work in Louisiana. And I think it's a nice segue from Tom's presentation in terms of legislators in the state of Louisiana have already taken some important steps to help unify our system to really address that early achievement gap. And roughly 5 years ago, our state board and our legislators realized that there was an achievement gap, that only half of Louisiana children were entering kindergarten ready. And so in turn, to address that, they passed a transformative law known as Act 3 in 2012 to unify all of our publicly funded programs that serve our most vulnerable, most at-risk children, to set higher universal standards for those with a focus on getting kids kindergarten ready rather than sort of one particular input or another. At the same time, and sort of subsequent laws passed, the state has also tried to infuse choice into the system, so really helping to kind of raise the bar but make sure parents can choose the best option and have access to quality options. And as what I'll sort of talk about in the years since this law was passed to address that achievement gap, to bridge the gap between early childhood and K-12, we have done work both at the state level and kind of even more importantly at the local level by kind of establishing local networks in every community, centralized state oversight for everything from licensing to funding, basically kind of forcing a question that we are currently grappling with is how do we make sure every at-risk family in Louisiana can choose a quality option that best meets the needs of their kids, that they understand what's happening in that program and how we'll prepare their children for kindergarten, and what does it mean to kind of fund this statewide in a sustainable way. Next slide, please. So before we jump into the details and how of this reform and kind of how it's taken place, some of the key ingredients, many of which echo the recommendations that come from the Equity Starts report, I wanted to share just the overall vision, because again, it's like we knew the goal in mind, right? How do we make sure every kid, particularly our most at-risk kids, right? Because as Tom noted, it's our disadvantaged, our children with special needs, our English language learners, and our low-income children from low-income families that are more likely to start behind, stay behind, and not have that same opportunities that their higher-income peers may have, and that's just not fair for kids. But it's what that means, right? How do you make sure every kid enters kindergarten ready? Touches on a couple of key fundamental beliefs for us, which the first of which is we believe that every child in Louisiana can learn, should have equal opportunity. And so you have shared standards for what kids should learn and be able to do. and what you want to see happening in those classrooms. And those are not, those are not third-grade classrooms. Those are not eighth-grade classrooms. These are classrooms for 1- and 2-year-olds, 3- and 4-year-olds, right? And so you want to make sure it's age-appropriate, and it's at that stage where kids love learning. So that kind of goes to the next piece, is that we fundamentally believe it means that you got to have teachers at every classroom, regardless of program type, right? And we don't call them babysitters. We don't call them workers. We call them teachers, whether it's in child care, Head Start, or pre-K, who are excellent at interacting with children, right, whether that's a toddler or a preschooler, and guiding learning in a way that's age-appropriate. We want to make sure in all of our programs that there are clear health, safety, and learning expectations, and that we are leveling the playing field around funding. So as Tom again talked about, starting to kind of reduce some of the barriers, enable local communities to say, here's what my need is, here's how many kids I have, here's how many slots I need, right? And then to sort of let the funding flow to match the needs of the communities, rather than say, it's this program and that program and here are all the strings attached. With the ultimately goals, with parents as children's first teachers, making sure that families can easily enroll and can choose the best option for their children, and then making sure we're understanding what quality looks like and how to get it in every classroom. Next slide, Julie. So what I think is important to note, and sort of the visual of this slide as you're thinking about this as a state legislator, is that you've got to have, in our case, we've had this wonderful example of a transformative piece of legislation, right, that really said, we as a state are going to address our early achievement gap. We are going to give every child the opportunity to be successful in school and in career by making sure at the earliest points that they provide or get access to the things that help prepare them to be successful. But of course, it takes multiple years then to take that vision and to say, how do you get that to scale? How do you get that kind of shared ownership so it's not just sort of a law passed or a mandate, but that there's true collective community level ownership? And so the important takeaway from this slide is that our legislature and sort of state board were extremely forward-thinking and kind of calling this law, and they've actually passed subsequent pieces of legislation to unify child care licensing, enrollment, and funding. But there's also been equally important local work to pilot this, right? It's big change. You don't want to try to bite it all off at one time, right? To actually say, we're going to charge every community locally to do that, to scale that as communities are ready to come on board. It's taken 3 years to get to every single community in Louisiana, but every single community has now established a community network, and to make sure that you learn as you go. And so we piloted this first. We started small. We grew over time. We set the policies after we piloted so we could actually learn what's working in the field, what's not, and make adjustments. And then most recently, once we got to statewide implementation, again, we had a full practice year so that as we're creating the policies and revising the policies, we continue to learn from the field, ultimately with the belief that, all of the design, all of the policy for this, although it has to come out of a state capital or out of a state board, that so much of it should be informed by families, by providers, by local leaders who are doing this work every day. And I think that's kind of an important principle as we start to move into the things recommended by the council around how do you get that local engagement, how do you engage families, providers, leaders, and people get engaged when they can own things and they can create the solutions that work best for their community. So that's been a key core belief throughout our work. Next slide, please, Julie. And this goes into that kind of detail here. So what we had, the law called for unifying the system, creating a unified rating system, and calling on everybody to work together. We then created this local model of a community network pilot that involves all of the publicly funded programs. So everybody must participate, child care, Head Start, and pre-K. As a community, they must count all their children. As a community, they must go in and observe every classroom using kind of a high-quality tool. And as a community, they must implement a coordinated process to help families enroll, from providing them good information to helping them understand what they're eligible for, to actually running a process by which they can apply, select their top preference, and be matched with that. So that's a key thing, and what this map shows is sort of step-by-step we've gotten to every community in Louisiana. It also means that the implementation of this law looks a little different in each community as they have made it work for their programs, for their families, for their kids. Next slide, please. And as I noted before, the advantage of piloting and empowering communities to develop a solution that works best for them both enables ownership, but it also really inspires innovation. And so that's kind of helping folks say, you have the tools to figure out what works for your community. We've seen something similar through our implementation of coordinated enrollment. So our initial law called for unifying the system. As we began to do that, we realized that it's difficult to unify the system and enable parents to choose the best option for their children if there's not a requirement for coordinating enrollment. So our legislature passed a separate law that basically said, we want local communities to work together to coordinate information so families know of seats, to help families know what they're qualified for, to coordinate the application process, and ultimately to match. And with the way the law is written, it says we want local communities to do this. The best way for Louisiana to achieve this would be for everybody to figure out what works best for their community. If they fail over a certain period of time to do that, then the state will step in. But it really places the charge and the expectation on the local community. And then we use state funding and federal funding to actually support them to do this. And what you see is that's not only kind of helped everybody develop a parent choice model in their community, but it has also enabled us to really sort of encourage innovation. So at the bottom of that screen, you see different ways that folks are doing this, from new websites that say kind of step one, what are my options, to videos helping to walk parents through the process. And there's one application in New Orleans, the online process, to billboards in Northeast Louisiana where they have a preschool roundup. There's not a lot of use of websites in that area of the state, and so they actually do an in-person meeting where they bring all the providers together and they walk the family step by step. So here's what's available, here's what you may be eligible for, here's how you apply using a simple 2-page application, and then matching you to where you prefer. So again, in this sort of similar to that law, sort of passing a law that says, here's what we want all communities to do, but allows enough flexibility for them to figure out how do we meet the needs of our families and also have enough room to be innovative, iterate, and meet those needs. Next slide, please. One of the other kind of key points noted in the guide, and what we've been thinking a lot about in relation to ESSA, is how do you close the achievement gap, and how do you be very clear and transparent about expectations for all of your programs, right? So that there is this shared ownership of getting every kid to kindergarten ready. And so in that transformative law, our legislators said, right now we have a whole bunch of systems in place, right? We've got a star rating system, we've got letter grades for schools, we've got Head Starts on a separate federal system, and it is impossible for families to understand sort of what is out there, what they can expect, how well these programs will prepare kids like theirs for kindergarten, and to know that and to make that choice. Similarly, it makes it really hard for programs to figure out how do I advertise what I'm doing and how do I know kind of where to improve if I'm getting measured in different ways and different times and different systems. And so what we have done after years of pilots is launched a statewide unified rating and improvement system with practice profiles in all of our programs that basically define how we're going to measure everybody, provide clear, simple information about what's happening in classrooms, with the idea being what kids are experiencing in those classrooms is the single biggest indicator as to whether they'll enter kindergarten ready, to articulate a pathway to improvement, and ultimately kind of through a one-page profile that will be published is to help families get an easy way to compare choices in their community. And as I noted earlier, all of our publicly funded programs have to participate in this rating system. So that's childcare that takes public assistance, Head Start, and pre-K. and that this profile system is a little bit unique in terms of it focuses on what's happening in the classrooms. We use a rating that's related to outcomes, the class measure, which looks at the organization of the classroom, the climate of the classroom, and the actual instruction occurring in the classroom in an age-appropriate way. And then also includes some just general information on best practices, things like using curriculum, maintaining ratios. But we as a state have basically gone in and observed every single one of our classrooms and are using that information measured in the same way in a clear and transparent manner to share with parents, with providers, with the broader public about what is and is not happening in our early childhood classrooms. Next slide, please. And this gives some detail about that. So roughly speaking, we did nearly 15,000 observations of our classrooms last year. And as I said before, this is a big aha for us as a state in terms of we know what's happening. We've measured it all in the same way, so we know we're comparing apples to apples. And we have made a lot of progress as a state in terms of some of those environmental factors, positive environments, kids are supported, there's positive language, there are routines in place, and the adults are managing the kids' behavior appropriately. But across the board, child care, Head Start, and school, we do not have the level of instruction we want. And that is really part of the explanation for why we don't have kind of our kids entering kindergarten ready, and that we have sort of one of two things happening. On the one hand, we have places where there is no intentional instruction whatsoever, where kids might be left to their own devices, they may or may not have appropriate materials to play with or engage with, and that there's just not much intentional learning going on. And on the other end of the spectrum, we have classrooms with certified teachers, but there is not dynamic learning, that these are rote activities where you might be reading a book at a group. There are simple questions rather than actually encouraging analysis and reasoning, and there's not a lot of dialogue, a lot of engagement for kids to connect concepts, connect it to real life, really to develop those critical thinking skills, that executive function that is needed to be successful, in the modern world. Next slide, please. And so what this means for us is that as we are thinking about, how do we sort of take this information, and we basically have a unified accountability system and support system, and we need to sort of do two things with it. The first of which is how do we use it to systemically encourage improvement across our child care, Head Start, and school programs, and then secondly, how do we use this information and connect it to our K-12 system? So let me speak to the first point. So the first of which is, and this is a somewhat complicated slide, but what this reveals, is kind of the importance of using a unified system. Because what you see is, although there are some structural issues, right, child care is funded at a much lower rate than schools, and typically to be a child care teacher in Louisiana, all you have to be is 18, right, and you're comparing that to a much more funded school program with a bachelor degree credentialed teacher. You see that on balance, schools provide higher quality experiences than Head Start. Head Start is higher than child care. And so you think, wow, a piece of that clearly is the systemic issues. On the other hand, you also look at with the very same, and all of our schools have the same high quality requirement, I believe we're either 8 or 9 of the near benchmarks, you see a wide range of differences in what kids are experiencing across that, right? Same money, same credentialed teacher, same ratio, and yet you have centers that are excellent in providing excellent instruction and experiences for kids, and you have centers that are, towards that, almost at that needs improvement level and that low sort of approaching proficient. And again, this is, schools, and so a part of what we will do going forward is actually sort of by providing insight to programs, really kind of to work with them to focus, regardless of the structural issues, how do you focus in on what is happening day in, day out in classrooms? How do you improve those interactions and instruction across the program type, and make sure that everybody, regardless of program type, is moving up that curve? Because this graph also demonstrates that excellence is possible in Louisiana. Our challenge now is to get everyone there. The second piece, and I should note this, is that the only quote-unquote consequence that will be for our lower scoring sites right now is that if you are at the very sort of a needs improvement, a very low quality site, we have basically added in a consequence to say that you will have 2 years to improve, but failure to get above, out of that very low quality bracket within a 2-year period of time with the supports offered by the state means that you will not be able to operate anymore as a publicly funded provider and to serve our most vulnerable kids. So there's only a handful of those sites across the state. We plan to work with them intensively this year to make sure that they get every resource they can to improve. But we do not want to have any very low quality sites in Louisiana taking public dollars to serve at-risk kids. Next slide. And the key point, and this kind of bridges the point earlier about sort of unified accountability and support and then building a high-performance workforce, which is what I'll wrap with. But there's 2 advantages to a unified accountability and support system. The first of which is you have an apples-to-apples comparison within a community, across communities, about what kids are experiencing, which really provides that information for families and providers. The second advantage is it helps you really focus the support resources. So rather than spending scarce resources on a whole bunch of different tactics and techniques for improvement, some of which may work, some of which may not. We have really worked to unify our support for programs and making sure that that's kind of consistent across program types, simplifying it and making sure that every classroom has supports that are aligned to the way in which they're being measured, looking at things like curriculum, looking at assessment, providing folks with universal access about what tools are good, supporting people to use those tools, and then doing hands-on work, particularly with childcare, around foundational training, coaching, on-site assistance to help improve those interactions and instruction. And we have organized every one of the bullets in these 3 bars, totally focused on how do you improve interactions and instruction, which allows for a better use of those scarce dollars, as well as an easier way to check, is this working or not? And last, but certainly not least, if you'll move to that last slide, all of this work has led to kind of a fundamental question about how do you make sure you have a prepared teacher and a professional workforce? And, making sure we're measuring everything in the one way is one piece of that, but you're thinking back to the point I made earlier about how do you compare kind of a child care setting that has, a teacher without a credential at all, a 19-year-old with, an actual professional career, Head Start in child care. And so what we are doing at the same time that we have done, been sort of building these community networks, building this rating system, is to figure out how you get to a high-performance professional workforce across the program types. And specifically what that means is maintaining the requirements as is for pre-K and Head Start, but establishing new certificates, new credentials for child care that is based on a child development associate, but we will have a Louisiana flavor to it in that we're actually going to promote programs that provide practice, that provide mentoring and coaching. But if you're going to go back to school and get this credential, it'll do 2 things. One of which you will have enough opportunity to learn and to practice so that you'll be effective when you come out and are working in a Louisiana child care classroom, and it'll be a stepping stone towards a new birth to kindergarten bachelor's degree. So you can kind of step by step, we can help you professionalize your experience in your resume while also helping to professionalize the workforce and ideally kind of begin to raise up the compensation. So with that note, I think it's sort of to summarize, I say, as we said, we've got a community network in every community in Louisiana. At the state level, we've moved child care, Head Start, school-based pre-K, all into one agency and are providing centralized oversight, funding, and guidance and support. Now, as we kind of can compare apples to apples, support everybody to improve, it continues to raise the question on how do we maximize the dollars that exist, meet the needs of local communities, but ultimately increase the investment so that we truly are fully, leveling the playing field and funding each community, each program to prepare all kids for kindergarten.
Thanks so much, Jenna. Tom, did you have any comments or questions before I go into the questions from our fellows? Yes.
great to have any questions that you've received from the fellows, either before or after the broadcast, to get going with those.
Sure. I'm just going to do two quick questions for Jenna, and then we'll move on to Clayton. So we have a question from one of our fellows, specifically for Jenna, about what is the funding per student for the Louisiana program?
So it ranges slightly. Roughly, it's about $4,600 per child for the pre-K programs, about $6,500 or so for the Head Start, and we have made recent strides in child care assistance to get to roughly $4,000 per, let's call it 3 or 4 year olds, slightly higher for infant toddlers. So it's generally low compared to kind of national standards, and child care is still the least funded, but we have made policy changes to child care assistance in our state to kind of get it more equitable to pre-K. I should also note that Louisiana has a set of extremely exciting, innovative tax credits that are used to promote improvement in child care. And so when you combine our child care assistance and you have high-quality centers that get additional tax credits, both for centers, families, and for staff who get credentials, it is getting closer to a level playing field, although not perfect. And we think we're still below where we'd like to be funded. We have looked at cost factors in Louisiana, and we have a cost model on our website that basically says to get to kind of a general level quality, we need about $5,200 per child for 3 and 4 year olds, and $6,500 per child for infants and toddlers. That's our goal.
Thanks, Jenna. So the other question I'm going to do is from, another fellow. In your community network model, there's a lead agency that presumably coordinates the efforts of the programs in the community. What type of agencies are typically taking the lead? How are they empowered? And is there state funding appropriated to these community networks? And if so, is that through the Department of Education?
Yes, so we do have a lead agency in each community, and it's been an open application process. We put it out there so that anybody from nonprofits to school boards to Head Start programs to businesses could apply, but it has generally been school districts that have, in about 90% of cases, have stepped up and played this role. We also have a Head Start agency, and we've also had resource and referral private 501c3 organizations in their community step up. We fund them to do the observations, to coordinate enrollment, and to kind of convene local leaders. And so we use a combination of state funding, IDA funding for children with disabilities, and a CCDF federal funding to support those lead agencies. And we run a competitive process by which you have to demonstrate the support of your community in order to be considered. And then we provide quarterly support. We got a lot of technical assistance to those lead agencies to be successful.
Sounds great. So now we're going to move into our last presenter, Clayton Birch. Oh, great. It popped right up. So Clayton, go ahead with your presentation.
Hi, good afternoon. I will be cognizant of time and try to tell the story as efficiently as possible, but I get wrapped up in Jenna's. That's I don't know how many times I've heard Jenna's story, and I think I learned something new on the Louisiana story at all times. So I'm going to try to demonstrate and tell the West Virginia story, and it'll be a bit of a different story. I'm going to go back a couple decades of how we got to where we are, but at the end, it's going to be similar to Louisiana, and it's this deep-rooted vision and commitment that we want to do for early childhood education. And in West Virginia, for about 3 decades, we've been having this discussion. We've had, from the 70s through the 90s, we had a strong kindergarten program. And then in 2002, because of our partnerships and champions in our legislative branch that stepped up and really wanted to take the early childhood discussion a step further, we've been very fortunate in West Virginia to have these partnerships with legislation to get us to where we are. So I'll try as best I can to tell that story. For complete transparency, West Virginia is very, very small. We have 55 counties. Each county is its own school district, so there are 55 LEAs. There's about 20,000 kids per grade level. Just as Jenna, and I know that they deal with in Louisiana, this idea of the achievement gap has been a major issue in West Virginia, what we deal with the ruralness and poverty, and most recently drug epidemic. And achievement has been a major issue as we tackle this. And one of the issues in 2002 that they thought they wanted to tackle was we do want a long-term vision for the early childhood, and we believe that committing these resources to early childhood is going to make a difference. But in the state of West Virginia, they chose to start with that commitment with a universal pre-K system. So in 2002, we really consider that this catalyst of change that's happened in West Virginia. And the legislation decided in 2002 to pass a universal pre-K bill. And we didn't have a lot of places to go to look at, what it looked like or is it working in other places. Nobody was really doing it the way our legislation wanted to do it, which was we're not going to target specific children just at risk. We wanted a system for all. Every 4-year-old in the state, we wanted to have free public universal pre-K. And some of the caveats they put with this, though, was we also want to do it with families and children in mind. We want to honor the current workforce in the state. We want to honor the current early childhood system in the state, which is Head Start child care. So they passed the legislation, and if we can go to the next slide here. A lot of things happened with that piece of code. They tackled a lot of things. They tackled funding. They tackled collaboration and how they expected this to roll out. But one thing that's not mentioned here on this slide is they also didn't kid themselves. They knew this would take a lot of work. They knew that if you're going to try to transform your early childhood system and create this universal pre-K, it couldn't be done overnight. So this bill passed in 2002, and they set a 2012-13 goal. And they said you'll have 10 years to really build this system. And the supports we're going to put in place is, yes, you are going to partner. We expect partnerships. We expect collaboration. And we had a goal, they said, at 2002, and we expect all pre-K programs in the state of West Virginia to be collaborative by at least 50%. Well, by 2014-15, that collaboration hit 79%. Once the collaboration got rolling and folks figured out how to best leverage funds, resources, the workforce, our Head Start child care and public schools really began to come together to create this robust system that, like you see here, 79% of the classrooms in the state are collaborations. The bulk of those, around 60 to 65%, are collaborations actually with child care. And that's a new phenomenon happening in the state of West Virginia, that if we're truly going to be universal and we're going to work with our partners and we want to serve children, that we've really seen this breakdown of barriers, and we're seeing that the Head Start services, just as if special ed services, are available throughout the system because of this collaboration. The next thing the legislators did, though, they did look to the future for funding. They built our universal pre-K system on the school aid funding formula. So our pre-K system for 4-year-olds as well as 3-year-olds with special needs is built on the school aid funding, so it's funded at the exact same level that a 3rd grader, 5th grader, middle school child would be funded in the state. As of about fiscal year 2015, that equaled about $91 million for about 70% of the kids attending is voluntary. But we also have, in addition to that, because of the way we leverage funds and collaborate, we're able to tap in and have Head Start funds and child care funding. I know Jenna mentioned the CCDF funds that also assists. So that was a pretty big agenda that they put together that they wanted to have roll out. And the governance structure they decided on was interesting. It was going to be a governance structure where the West Virginia Board of Education, Department of Education, along with the West Virginia Department of Health and Human Resources, was actually going to partner. And even though it became a school policy, a public school policy, because of the way the funding streams were set up, they really tied the system to this collaboration. And in fact, so much so that the governor and the state board worked together with the secretary of DHHR, and as the system was built, decisions locally had to be made up with a similar makeup. So we have local collaborative teams at every county that's public schools, child care, Head Start. And for the first 10 years of the system, in order to get their funding, they had to submit an application. And that actually indicated that they were collaborating, they were building, they were working toward a 10-year goal. And that was actually tied to funding for the first 10 years. So a few of the milestones that did happen, these are similar to things you saw Jenna talk about in Louisiana that was really important. We had to have consistent early learning frameworks, content standards. There had to be a policy developed that we were all going to play by. And as you see here on the milestones, we also had to be flexible. We were entering uncharted territory, and we had to be able to revise that policy as needed. So it's gone through several iterations. By 2008, the state board established a comprehensive definition of school readiness, and that'll come back to play on the next slide. But in 2008, we revisited the funding issue to ensure that there was equal state aid funding across the system. So we did a study at that time to make sure that our funding was being used with all partners and the ability for state aid funding to be used in child care and Head Start. And in 2010, the state board created an Office of School Readiness. They really thought that this universal pre-K effort was a cornerstone in connecting our birth to 3 with our K-12 school system. And in fact, 2 years later, we ended up creating an Office of Early Learning that was pre-K through 5th grade. Now, at that time, there is a pause in the story. We were beginning to hit our 10-year mark, and we're finally getting that legislation that was passed in 2002. 10 years later, we were seeing it come to fruition, and we were seeing that this was making a difference, that we were seeing more families engaged. We were seeing more children enrolling. We were seeing more children ready for kindergarten. And at that time, we had a governor that wanted to take this a step further. And he asked us to really look at, along with the state board, to really look at our entire birth to 3rd grade approach. How well connected are we to the birth to 3? How well is the pre-K system really connected to the kindergarten to 3rd grade? And when a governor launched his campaign for grade level reading, it was interesting to have a governor, like many, that said, we want a 3rd grade target to close that achievement gap. But he based his entire campaign on everything else that had been done the 10 years before, which was the universal pre-K, our work with birth to 3, and our work around school readiness. So that, one thing we heard Tom mention before is, one of the questions out of the CCSSO report is, tracking progress, and is reporting at 3rd grade too late? And in West Virginia, 3rd grade is that kind of milestone that we believe that we need to look at the gap, and is the achievement gap closing? But we also, because of the system, because of how collaborative, and because we decided to go universal, clear down to the 4-year-old age, we're able to begin collecting information and identifying the gap at 4 years old, well before kindergarten. And it's made a big difference to identify the interventions and how to begin closing that. And then our new work with birth to 3 is actually assisting even further. We have a website called Ready, Set, Go West Virginia that is designed for parents, for them to be able to go to and download an annual report of how our schools are doing, every county, every school, down to the health and wellness of children, learning, and its trajectory leads to a 3rd grade reading. Kind of skip ahead here to the last slide. And more recently, the state board designated kindergarten. Even though we've had kindergarten since the 70s, full day, all day has been required since the 90s. In 2014, the state board redesignated kindergarten as part of the early readiness grades along preschool. We wanted to see the push up on developmentally appropriate practices, and we did not want to see this push down of developmentally inappropriate practices. So in 2014, the state of West Virginia has decided that pre-K and kindergarten are both together this multi-year from sometimes 3 or 4 until the age 6 or 7 that a child will be in a school readiness environment before entering 1st grade. So the governor followed suit, and our governor has actually identified grade 1 in the state of West Virginia as the school readiness grade, which has made a tremendous impact on what you can do in pre-K and kindergarten for that preparation. We also sought out, and that's one of the things I would encourage anybody that's beginning to look at how to begin champion early childhood legislation and look long-term. We also early on found national partners, folks that we could have through the journey that could assist us. And it's been mentioned by many here, but the National Institute for Early Education Research has been a great partner. And their annual yearbook and setting mile markers like the 10 quality indicators helped the state of West Virginia. This year, we were able to hit all 10 indicators and drive some of those quality indicators, such as teacher and assistant teacher certifications. And then in 2015, we've also joined the National Campaign for Grade Level Literacy and grade level reading. And the nice thing about that is we're seeing all these efforts kind of come together, and the emphasis on school readiness and high quality extended day and extended year programming, as well as our pre-K efforts. And, kind of in short, you have to start answering those questions after a 10 or 15-year period is it making a difference? Do you believe and really buy in that this is really going to close the achievement gap? And I will tell you, for the state of West Virginia, even though there's many studies going on and we look to a lot of different mile markers, whether it be the state of our children in pre-K entry, kindergarten, first grade, we do tend to also look at those third grade indicators. And we can tell you that some of the gains we've seen for simple things that we kind of draw our attention to, such as, the grade 4 reading on the national assessment, the NAEP. And for somebody like West Virginia to go from a ranking of 47 and the most recent ones to jump up 6 rankings to 41st, we've never seen gains like that before. And we have to assume and begin thinking that has to be attributed to this emphasis that's been placed on this early childhood birth to third grade system that we put in place. So, Julie, I tried to condense as best I could. Hopefully that was short and concise.
That was great. Thanks so much. Wonderful work going on in West Virginia. I am prioritizing the early learning fellows and their questions. We only have a few minutes here left, and I'm very cognizant of time. So whatever questions we don't get to, we promise we will email out responses to participants. So I wanted to, let's see, West Virginia, there was a question for you. Is it unusual to see a legislature willing to undertake such a long-term initiative? Out of curiosity, does West Virginia have term limits?
Yes, it was very unusual to see a legislation. And what's interesting is one of the key champions in that legislation in 2002, now in 2016, has been appointed as he's our vice president for the state board. But in 2002, when we saw that pass, that was very unusual to see a piece of legislation pass that when they passed it, they knew they would not see it come to fruition for 10 years out. But because of the research and because of the experts that they really brought to the table and listened to, they wanted to get it right, they wanted it to be high quality, and they really wanted it to be inclusive of our current system. And if you're going to build quality indicators into your current system, you got to have time for training, for that funding to really drive those changes.
Great. Back to Louisiana, I saw a question come in about specifically for Louisiana, but maybe West Virginia can comment on this too. Most individuals who work in child care facilities are generally making very low wage, so how is Louisiana incentivizing individuals to go back to school without losing their position?
That's a great question. So we think about that in 3 ways. I think the first of which is how do you address kind of the funding, at a center level so that that teachers can be compensated more. And we've taken some efforts to increase the rate. The second piece is really teacher focused, which is we have a set of tax credits that once you get that credential, you're eligible for a refundable tax credit year after year. So that's kind of the equivalent of a wage subsidy, that if you work 6 months in a center, you're eligible for each year so long as your center is participating in the rating system. And the third piece is now that we have taken responsibility for CCDF, we have committed up to $5 million over the next 5 years to sponsor programs, to offer the credential program in a way that meets the needs of local communities in partnership with child care directors, right, to kind of actually help them think about where do you need, how much you hire and retain. And there is sort of full scholarships for candidates to get the credential and take the test. So by kind of making it, no cost or extremely low cost, and by partnering with child care providers, we are hoping to not only professionalize the workforce, but drive down some of those very high turnover rates. It's a challenge. It's a challenge in the sector as it gets to higher degrees. They can go on to Head Start or to schools, but I think we have to sort of systematically help kind of raise each level and make sure that we're supporting professionals to take those steps.
Thanks. I have a question here about, I think it's for West Virginia. Did you borrow funding from existing educational funding, or is this, are you finding new funding sources?
No, it was actually, from the beginning, we built the system on the school aid funding. So basically, as you increased over a 10-year period and built your system, as enrollment increased, your state aid funding increased from the state. So a very rural, poor state like West Virginia, we were seeing declining in enrollment. So over the course of a 10-year period, the net investment ended up being, close to zero, because as we increased four-year-old enrollment into the state aid funding, it actually zeroed out with the loss of enrollment in our state.
So what percentage of children participate in West Virginia's early learning programs?
Four-year-olds, we hit this past year right under 75%.
Okay. So I see a question about the Louisiana School Readiness Tax Credits, and we have information available on that, so I will definitely get that out to our early learning fellows. And we can also follow up with Jenna with any specifics that fellows might have. So I just wanted to give the last word to Tom. Tom, did you have any final thoughts, comments before we finish our webinar?
No, I would just reflect that I think both the Louisiana and the West Virginia stories really illustrate strong state leaders in state agencies, but also a good relationship with the legislatures in terms of, setting challenging targets for their state, but also sort of like sticking with this agenda. The Louisiana story is a relatively recent one in terms of the duration of it, but I think both of them show that change can really happen when we have this kind of partnership between leaders in the legislative side. Obviously, a strong early childhood community is a part of this picture, which we didn't perhaps talk as much about, and then strong leaders in state agencies. So I'm just really commend the folks in both of these states for the examples that they provided about how we can do a much better job in this area, and that there's a payoff to it for children.
Thanks, Tom. I agree. And unfortunately, I have to finish this webinar. We're a little bit over, and I want to be, cognizant of folks' time. So I wanted to thank so much our presenters today, Tom, Jenna, and Clayton, for their thoughtful comments. I especially want to thank Tom for working with me on this webinar and being a great colleague throughout the years. And the work that you do is really important. So thank you so much for you and the work that CCSSO does. I want to remind folks of participants of the resources on the web. An archived copy of this webinar is going to be available to you shortly, and I saw that some folks weren't able to get the slides, so we'll make sure that we forward those to you as well. Your feedback is really important to us in creating a meaningful and beneficial program. Once this webinar is done, an online survey is going to pop up. It's a few questions, and it'll take a few seconds of your time. Please take a few moments to complete the evaluation survey. We take your feedback seriously, and we want to hear your thoughts. For the Early Learning Fellows, our next webinar will be September 15th, and we're looking forward to seeing you on that webinar. We're going to hear the latest research on social-emotional skills in children. And we also really look forward to seeing the fellows at Summit. I just wanted to make a plug for everyone on the call about our legislative summit in Chicago. We've got some sessions planned around early childhood learning, so go to our website, check it out, and register. Again, our resources, you can learn more about the Early Education Project and our Early Learning and Support Project. You see, the links there on the web. And I think that's all that I have for now. Finally, please remember that NCSL is here for you. If you have any questions, comments, feedback, feel free to email us, the Early Education Project. You see our email addresses there. And that is it. That's all that I have. I hope everyone has a wonderful rest of the day, and thanks so much for participating in this webinar. Thank you.